Who's there?
Hi, I'm Audrey Tapang. I'm one of the community nurse, and I'm looking for Miss Leia Salonga for his insulin injection.
I'm Leia.
Hi, Leia. How you doing?
I'm okay, thank you.
Are you expecting me?
I am.
That's great. So, Leia, may I come into your house?
Yes, you can.
Before I do that, is there any small children's or pets that I should be aware of?
No, I don't have any.
Lovely. So I'll come in, making sure that I close the door for Leia's privacy and for my safety, but I will not lock it as well. So Leia, I'm here as I've mentioned because I need to give your insulin, and I think this is your first time having it. Is that correct?
That's true.
Lovely. So Leia, what I need to do is just to quickly read to you what's in the chart and explain to you why we're giving the insulin at this time of the day. Is that okay? So it says here, Leia Salonga is a 39-year-old, newly diagnosed insulin-dependent diabetic living alone at home. Is that correct?
That's true.
Although usually independent in all activities of daily living, you're a bit unwilling to administer your own insulin, which is totally understandable because it's your first time. But hopefully, we could improve your confidence in administering your own insulin. But if not, we're always here to assist you and guide you until you feel more confident to do that yourself. Is that okay?
That's fine.
Lovely. So now that I have explained and discussed the procedure with you, can I just confirm with you, Leia, what is your full name and date of birth, please?
Okay, Leia Salonga. My birthday is 3/8/1982.
And that matches my documentation, so that's lovely. And the address here is 22 Maple Street, Northampton, NH71HD. Can you confirm if you have any allergies?
No, I don't have any allergies.
Lovely. So that matches my documentation as well. So reading through the prescription here, you've got a prescription for Actrapid insulin subcutaneously 20 units with batch number 1234, which I will counter check with the drug later, to be administered today at 8 a.m. Prescriber signature by Dr. S. Ravi today at 8 a.m. as well. So I can confirm that this prescription is signed, valid, and legible. Can I confirm, have you had anything to eat before we proceed?
No, I haven't had any yet.
Lovely. So that's good. After we've given this medication, you will just have to have your breakfast just to prevent any hypoglycemic episodes as well, okay? And I forgot to mention that this has to be given subcutaneously. Do I have your consent to proceed?
Yes, you have my consent.
Lovely. So now that I have your consent, is there any hand? Can I use that hand gel over there?
Yes, you can.
Lovely. So I'll just prepare my materials and I'll be with you shortly, okay?
Okay.
Lovely. So now I'm ready to gel my hands following the steps of World Health Organization, palm to palm, back of the hands, interlace, interlock, thumb, fingertips, and let that air dry as well. So are you still okay, Leia?
Yes, thank you.
That's great. So Leia, what I will be doing is I just need to put this apron on, and I can see that you're sitting down already. Are you comfortable in that position for me to give the injection?
Yes.
Okay. We've already closed the door, so we have ensured your privacy as well, and you are seated on a upright manner and you're comfortable to have that as well. Now I just need to visually assess the site of injection. You could have it in your tummy, which is suggestible because for easy absorption. Are you happy to have that? So am I okay just to pull down the covers for a bit?
Yes.
Okay. So pull that down, and I can see that there is no signs of inflammation, infection, edema, or any skin lesions as well. Also, I need to remind you, once you have this, every time you will be having your insulin injection, you have to rotate the sides just to prevent any tissue damage as well. Is that okay?
That's fine.
So other areas where you could have this would be on your leg, on your deltoid as well, or your upper arm. But as I've mentioned, it is suggested that you have this around the tummy. We could just rotate the sides so that it could easily be absorbed. Are you happy with that?
Yes.
Lovely. So now that I have your consent, I would want to clean my hands again. And then I will just be preparing my materials, okay?
Okay.
So let that air dry for 20 to 30 seconds, and I'm happy to put on my gloves. So I'll be preparing my materials. So I have here a disposable tray that is clean, visibly clean, and I'm happy to use this. I have here my Actrapid, which is my medication with a batch number of 1, 2, 3, 4. And Actrapid,
100 units per mil.
and my patient is prescribed 20 units. So I'll be giving 0.2 mil or 0.2 mil to my patient. Expiry date is 10/2026. It's clear. It's an open and no precipitate, so I'm happy to use that. But before we do that, I want to clean the top of my medication for 20 to 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'll discard that later. So now that I have that, I need my insulin syringe as well, which is dry intact and expiring on April 2027. I'm happy to use that. And I have my gauze as well, just in case there's any bleeding, which there should be not, but I will just have this ready as well. And another Clinell wipes as well, just in case the site is not clean. And if I need to clean this injection site, I will clean it with isopropyl alcohol 70% for 30 seconds, and I will let it air dry for 30 seconds. But I can visually see that my injection site is clean, so I won't have to clean it. So now I'm ready to prepare my medication. And I would need, as I've mentioned, 20 units. So in my syringe, I have the proper insulin syringe, which is which I could get 20 units. Assessor, can you confirm that this is 20 units?
Yes, it is 20 units.
Lovely. So now that I have this, I will go back to my patient, ready to give this medication. So, Leah Salonga, could you please confirm once again your name and date of birth, please?
Yes, Leah Salonga, 3/8/1982.
Lovely. So now what I will do is, I will pinch the skin into a fold. Are you ready?
Yes.
Pinch the skin into a fold, and then I will hold the needle between my thumb and forefinger like I'm grasping a dart, okay? So I'm gonna inject this now. So sharp scratch. And this has to be in 90 degrees if we're giving insulin. But other medication other than insulin, this could be given in a 45-degree angle. So now that I have hold and pinched it, I will give the medication for 10 to 30 seconds, but I'm going to count to 10 seconds, okay? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Remove that immediately. Release. How does that feel? Is that okay?
That's fine.
Lovely. So now that we have injected your medication, just to wipe off excess there, but I don't see any bleeding. What I need you to do now is to have breakfast right after, so to prevent any low blood sugar episodes or signs and symptoms. I will be staying here for the next 30 minutes to 1 hour just to observe any signs and symptoms, okay?
Okay.
Common side effects of this is, as I've mentioned, low blood sugar. That's why you have to eat right after. Redness on the site or pain on the site, it will just be a momental. It will come off soon. But if ever it is lasting longer than you think, just do let me know or just ring the GP as well so that we could assess it, okay?
Okay.
Lovely. So while I'll put this cover back. So while you're doing that, I'm just gonna put my materials away and document, okay?
Okay.
Lovely. So before I do that, so also I have ensured when I was checking my materials that the sharps box is not 3/4 full. So I'm happy. And as you can see, after I have injected, I have thrown it straight away to the bin. So we do that. Put this away, and then I need to throw this, put this back into the patient's fridge or medicine cabinet, but making sure that it's properly covered as well. And I will discard this to the clinical waste bin. So discard that to the clinical waste bin. And then I'm ready to gel my hands again. Let that air dry, and then I want to document. So now that I've documented, I'm all done and 30 minutes is over. How are you feeling? Have you had your breakfast?
Yes, I did.
That's great. Are you feeling any untoward signs and symptoms?
Not really.
Okay, that's good. You have my number. You have your GP number. Just to give us a ring if you need, if you have any questions or if you need any information. Okay?
Okay.
Lovely. Thank you so much for accommodating me and for being cooperative. I will go now, and you have a good day. Okay?
Okay. Thank you.
And I will end my station before I leave by doing another hand hygiene again.